Senator from North Carolina.
Thank you, Mr. President. You know that this week there's a lot of talk about the imminent decision on the Supreme Court ruling of King versus Burwell. And I'm going to get to that a little bit later in my speech, but I'd like to start by talking about how we got here. I'd like to review what the Americans were told as the reasons for Obamacare. It was supposed to help the 50 million people who are currently uninsured to get covered with quality, affordable insurance. Everyone else, we were promised, would be left alone. Remember that promise? If you like your doctor, you can keep them. If you like your health care, you can keep it. That's the first of several broken promises that Obamacare has ultimately produced, and I'm going to go through a few this afternoon. Let's take a look at what's happened since Obamacare was implemented and where we stand. Most of the uninsured nationwide are, and they were prior to Obamacare, working families, 71% in 2013. They either couldn't afford the cost sharing of their employer plan or their employer didn't offer a plan. Of those who got insurance under Obamacare, too many of those were working families who actually didn't get private insurance under Obamacare. They were ultimately forced into Medicaid, which is supposed to be a safety net, not a permanent solution for working families. Is Medicaid the quality, affordable insurance we all want for Americans and that people thought they were getting with Obamacare? I don't think so. The provider payment rates in Medicaid are so low that many doctors refuse to see patients and participate in the plans. And I don't really begrudge the doctors and the healthcare providers for this, because the cost of care oftentimes exceeds the Medicaid reimbursement rates. And the red tape that comes with it absolutely is destroying the administrative side of healthcare. That's why doctors don't participate in the plan. That's why the doctors are not available for the people that actually need good quality health care. It's not for lack of investment, though. States are drowning in unaffordable Medicaid programs that eat more and more of their budgets at the expense of other essential services. States are throwing everything they can and then some at Medicaid, but it is still unacceptable in terms of cost, quality, and access. That's exactly why North Carolina refused to participate in Obamacare's Medicaid expansion. I was Speaker of the House in North Carolina at the time. We know if we're going to solve the health care problem, it has to be a real solution. We have to bring back a vibrant, robust, patient-centered private insurance system, customized for our state rather than dictated by bureaucrats in Washington. My constituents deserve a plan that pays doctors fairly, so that provider networks are big enough to ensure that people don't get turned away at the door. Herding more of our hardworking, proud neighbors into substandard welfare plan designed to be a temporary safety net is no solution at all. But that's exactly what Obamacare has done. The president even brags about it. In North Carolina, prior to the implementation of Obamacare, there were some 1.9 million of our citizens who were uninsured. Who are these people? 10% are already Medicaid eligible before Obamacare. Most of them were children. We could have enrolled them without ever passing Obamacare and disrupting and destroying health care for everyone else. About a third were people who were eligible for subsidies on the exchange, almost 500,000. So did all those folks get help? It might look like it. After all, 459,000 have signed up through the federal exchange in North Carolina. But wait, are those the same people, the same ones who were insured before Obamacare? It turns out that even more than that, 473,000 people had their plans canceled by Obamacare. 473,000 North Carolinians received a letter saying that the Affordable Care Act has determined that you can't keep your plan. They didn't like it, even though those who were insured were satisfied with their plans. And this was a nationwide trend. The Associated Press reported 4.7 million people had their plans canceled because of Obamacare. There was such an outcry that the president, by executive fiat, actually instructed the insurers to continue to allow the plans for a period of time. So how many people lost their plan at this time is still not clear. But what is clear is that the individual mandate is going to cause problems down the road. Those who lost their plan, who will lose their plan, are going to be required by law to buy a Washington-approved insurance plan, no matter how unaffordable Obamacare has made insurance. Again, in North Carolina, more people received cancellation notices for the plans they liked than have actually signed up for Obamacare. Between the 500,000 whose plans were initially canceled by Obamacare and the 1.9 million people who were already uninsured prior to Obamacare, we should end up with a wash, with no change in the uninsured figures for my state of North Carolina. But actually, we don't. The uninsured rate has gone down 2.7%, from 19.9% in 2013 to 17.2% in 2014, after the first full year of the Obamacare implementation. So roughly about 200,000 people in North Carolina. But were all of those people getting quality, affordable plans on the exchange as promised by Obamacare? Hardly. The reason is Medicaid enrollment. The majority of the people who the administration claims Obamacare covered have been those who went to the exchange to get insurance, but were then forced to enroll in Medicaid. And when I say forced, I mean forced. The law requires them to have insurance, but the exchange doesn't allow them to buy a private plan if they qualify, if they're eligible for Medicaid. It shows them one option, Medicaid. But wait, you say North Carolina didn't expand Medicaid. So how did this happen? It is true. Medicaid enrollment for my state has increased 300,000 people, the biggest enrollment increase of any of the states that didn't expand Medicaid. What that means is much, if not all, of the drop in the uninsured rate is due to North Carolinians enrolling in Medicaid through the exchange. These were the same people who were eligible before Obamacare was ever passed. Nationally last year, nearly 90% of Obamacare's net coverage gain was through Medicaid. A study from MIT released in April found that Medicaid enrollees received much less value from the program and the cost of paying for services. So far, I've been talking about people who were targeted by Obamacare, including the population of previously uninsured, as well as those who became insured because Obamacare forced them into the exchange. Again, Obamacare didn't really make a dent in our uninsured numbers, not to this point in North Carolina, and it actually harmed many who were forced onto the exchange. It turns out that Obamacare is an equal opportunity wrecking ball. It hurt the people it was supposed to help. It forced working families who needed quality, affordable, permanent care into a temporary program that provides the lowest quality access there is, Medicaid. Obamacare took over and removed the insurance options, the individual market for people who didn't have employer coverage, I should say, leaving those Washington-approved Obamacare plans with increased premiums, increased deductibles, and increased copays. You see, increased coverage doesn't necessarily mean better health care. If you can't afford your plan or you can't find a doctor, then your health care suffers. But that's not all. Obamacare broke health care for everyone else. Those of us who were supposedly happy with our doctor and happy with our health plans have been affected and will continue to be negatively affected. The majority of Americans who actually have insurance, what about them and their employer insurance? They haven't necessarily lost coverage yet, but they have been harmed. Despite the president's promise to lower insurance premiums, the average family premium employer-sponsored coverage has risen $3,500 a year between 2009 and 2014. In North Carolina, during the first full year of the exchange rollout, premium price increases outpaced increases in wages and inflation. losing ground to the American or to the working family. Even worse, premium prices in individual insurance market, a market that my daughter is a part of. The premium went up 147%. 147%. As a result of a plan that promised to reduce our health care costs, our insurance costs. Now, I know I'm not the only one who remembers what the president said about Obamacare. He said that the average premiums would go down $2,500. The reality is they've gone up an average of $3,500 a year. All this leads to the problem of people having insurance they can't afford, and they're not able to use it because their deductibles and co-pays are simply too high. Between this group and the group of people now on Medicaid who can't get appointments from a smaller group of doctors who accept Medicaid, what you get is a dramatic increase in the use of emergency rooms. This is exactly the opposite of what the supporters of Obamacare predicted. They predicted that emergency room visits would go down. We were told that once everyone was insured in Obamacare, people would go to their doctors in the outpatient setting and not show up in the ER. Instead, people can't afford the cost sharing, the co-pays, the deductibles to get an outpatient appointment, so they wait until their problem gets critical and then they go to an ER. In fact, the Kaiser Family Foundation reports that emergency room utilization is up significantly among Obamacare participants. In a survey of more than 2,000 emergency room doctors, 3/4 of them said the emergency room visits have risen since January of 2014. Medicaid recipients covered under Obamacare are struggling to find doctors who will accept coverage, so they have no choice but to end up in an emergency room where the costs skyrocket. A spokesman for the Emergency Room Doctors Association, Dr. Howard Mell, noted there was a grand theory the law would reduce emergency room visits. Well, guess what? It hasn't happened. Visits are going up despite the Affordable Care Act, and in a lot of cases, because of it. One of the most troubling elements of Obamacare to me is the intergenerational wealth transfer from the young and the poor to the older and the wealthier. And when I say older, I don't mean elderly and frail, the population who may be on Medicare. I'm talking about a welfare transfer from young people in their 20s to people like me in their 50s. I would never ask my daughter, who's about to start a career in nursing, to pay for her mother's insurance or for my insurance. Neither would any of you, nor any other American. That's not how parents are wired. But an impersonal law that empowers an impersonal bureaucracy does not have the same moral compass as a parent. For example, Obamacare's mandates have jacked up premiums for young people to keep premiums down for older people like me. I'm not sure let's fleece our children and grandchildren is a winning talking point. So the supporters of the bill try to hide the truth in Washington speak. They call this age rating bands. Another talking point that tends to not fly too well with folks is let's kick seniors off of Medicare Advantage plans. That's exactly what happened in North Carolina. Many of you that know about Medicare Advantage plans know it's very important and it's very popular among seniors. In my state last year, 57,000 seniors, more than any other state in the nation, were sent cancellation letters from the Medicare Advantage plans they liked. Many of these seniors were offered a minimum benefit plan with higher co-payments and higher premiums instead. All because Obamacare cut reimbursement for Medicare Advantage plans out of some bizarre but long-standing aversion to the program on the part of some of our friends on the other side of the aisle. I've never understood it. Does Medicare Advantage somehow give seniors too much control, stability, convenience, and their Medicare benefits? I suspect my mom is watching me right now in Nashville, Tennessee. I bet if you ask her that question, she'd say no. And just when you think it's really bad, realize that some of the toughest Obamacare hits haven't even been taken yet. First, the individual mandate penalty. The penalty for not having insurance increases next year to almost $700 per adult, or 2.5% of your annual income, whichever is greater. This is a penalty that many people were surprised or will be surprised to see when they get their tax return and they're expecting this amount, and it'll be $700 or $1,000 less to pay for the mandated care. If your individual income is $50,000, you'll pay a penalty of $1,000. A family with 2 adults with an income of $50,000 will pay $1,400. And you add a college kid to the mix, and the penalty is $2,100. A lot of people are in for a shock when they open up that tax refund and they see the additional hidden cost of Obamacare on working families. That penalty, however, is still dramatically lower than the out-of-pocket cost of an Obamacare plan. So we're forcing Americans to pick between bad and worse. Second, the employer mandate and penalty. President Obama knows the devastation the employer mandate will cause, not only for businesses, but more importantly, for workers. Employers will be forced to cut workers. They'll be forced to reduce wages and drop employer-sponsored health plans altogether and pay the penalty, because the penalty will cost less than the mandates will to provide the care. And many employers simply can't afford it. So far, people with employer-sponsored coverage have been harmed only by rising costs and shrinking provider networks. But they haven't, for the most part, lost their plans yet. The day is coming when the president can no longer delay the employer mandate, and that's when the plans they were promised they can keep will be canceled. We will see a massive disruption in the group market where most North Carolinians get their health insurance. Premiums are going up every year because fewer, younger, healthier people are enrolling than projected. This was completely predictable. Young people are no dummies. They know this is a terrible deal for them. As a result, insurance companies recalculate premiums based on the cost of the pool where people have actually enrolled. The largest insurer in my state announced premium hikes for next year. Now, you know it's a bad thing when I felt better about the fact that our premium increases in North Carolina were only 26%, because in some states they were upwards of 50%. And there's more to come. Obamacare relies on people paying into a pool to subsidize the sicker and poorer members of the pool. That's how insurance works. But virtually nobody is signing up who isn't eligible for the subsidies. CMS released data yesterday showing in 2015 exchange enrollment is 30% below projections made just 3 years ago. And those who do enroll, they're doing it because of the lure of the subsidy. 93% of the North Carolinians who are on the exchange receive those subsidies. That means that the plans are unaffordable without massive subsidies. Those ineligible for the subsidy don't bother to sign up. That's why we've seen almost no movement in our state for uninsureds. Obamacare is forcing employers to cut jobs and move full-time workers into part-time positions. New data show a decline in the average hours worked per week by lower wage employees, and many more workers are just below that 30-hour threshold, 30 hours a week. I was at a restaurant in North Carolina a couple of months back, and I was talking with the manager who said it's heartbreaking for her to go and talk to a single mom who was able to make ends meet between the tips and her salary at 40 hours a week, and tell her that she now can only work 30 hours a week because the restaurant simply cannot afford to be exposed to the mandates. Now you have people who may have been able to make it on 40 hours a week, 45 hours a week, having to get 2 jobs to make ends meet. I hear employers talking about how they're having to call each other to try and work out the schedules for these hardworking folks. Now the CBO projects Obamacare will reduce employment as a result of all this by 2 million full-time equivalent jobs in 2017. The President Obama campaign saying he wouldn't raise taxes on families making less than $250,000 a year. Let's talk a little bit more about that. Obamacare broke that promise as well by creating or raising 20 different taxes, amounting to more than $1 trillion in the first decade. Several taxes directly punish families making less than $250,000 a year. The University of Chicago economist Casey Mulligan modeled the macroeconomic effects of Obamacare, and he estimated that the damage would be twice as large. He expects Obamacare to cause a 3% drop in unemployment, or in employment, I should say, and work hours, and a 2% drop in our gross domestic product and worker income. If he's right, the total loss in worker compensation caused by the president's health care law will exceed $2 trillion between 2017 and 2024. So now let's talk about the King versus Burwell case that has everyone's attention, with the Supreme Court imminently in a position, or they'll be in a position to issue a ruling probably sometime next week. The question before the Supreme Court is this: did the president break the law by going around the will of the people in the states who wanted to opt out of establishing a state exchange, like we did in North Carolina?
Would the senator yield for a very brief consent agreement without interrupting his remarks?
Without objection.
Mr. President, I ask unanimous consent that, notwithstanding Rule 22, at 4 p.m. Today, June 24th, all post-cloture time on the motion to concur with respect to H.R. 2146 be considered expired, the pending motion to concur with amendment be withdrawn, and the Senate vote on the motion to concur, and that if cloture on H.R. 1295 is invoked, all post-cloture time be considered expired, all motions and amendments be withdrawn except the motion to concur with the amendment, and the Senate immediately vote on the motion to concur with the amendment. Further, that following the disposition of H.R. 1295, all time on the compound motion to go to conference under Rule 28 on H.R. 644 be yielded back, and the Senate vote on the motion and vote cloture with the mandatory quorum waived.
Is there objection? Without objection, so ordered.
Well, the majority leader's timing was perfect, because what I just finished is a very long list of broken promises and the fiscal disaster that we call Obamacare. But again, now I want to talk about the King versus Burwell decision. And again, the question is this: did the president break the law by going around the will of the people in the states who wanted to opt out of establishing a state exchange, like North Carolina? I'm not interested in litigating this. I'm not an attorney. I'm a businessman. I'll leave it to the lawyering to others. When I look at King versus Burwell, I don't see a legal battle. I see an opportunity. It may sound trite, but I see hope. The court may give us a chance of a generation, the chance to fix health care once and for all. We can't fix Obamacare, but we can fix health care. But here's the thing: we don't come up with some solution ourselves. The press is calling on us to come up with a solution. Others are pressuring us on the other side of the aisle. But here's what I think we need to do. I think that we need to look beyond the traditional way of trying to solve health care to a new way. And it starts with something fairly simple: humility. Now, I won't read the definition for you, but I think it is something that is sometimes missed here in Washington. Here's the solution: we take the power out of Washington and we let the states do it. We give states who are closer to the people the chance, the privilege really, to offer health care solutions that are local, accountable, and affordable. Every state's different. Let's respect those differences. I believe the solution is one that will give states the flexibility, the funding, and the control to decide how best to serve the people of their particular state. Now, I just went through the long list of problems with Obamacare. It's been problematic from the start, with higher costs, lower quality, less freedom, people losing their coverage. It's a badly written law, and it hurts almost everyone. Washington had its chance. Now it's time to let the states decide what's best for their people, and let the people decide what's best for their health care. To do that, we're going to have to do something we don't always do up here. We're going to have to jump on this opportunity and work together, Republicans and Democrats, the federal government and the states, and find common sense solutions that are truly patient-centered. That's the type of patient-first approach that will give patients more freedom, more choice, and control over their health care. That's what will expand coverage, not bureaucratic power. That will promote genuine quality and innovation. And it's also what's going to bring costs down. I don't think my responsibility is to my party. I don't think our responsibility is to the institution of the Senate or the prerogatives of the federal legislative branch. I think our responsibility is to the patients who deserve the highest quality care, to the patients who want the best treatments for their children, to the nurses and doctors who deserve freedom to heal according to their wisdom, their experience, and their conscience, to the businesses who deserve the freedom to design affordable coverage that fits their workforce. Finally, I think we are responsible to the seniors who have paved America's road to prosperity before us and who deserve a strong, secure Medicare program. The court may just give us the opportunity to firmly and finally reject Obamacare so that we can deliver what everyone in America deserves, a health care solution. The law has not worked. It cannot work. And it's time we return the power of medicine to the people. It's time to stop fighting and start cooperating and find a permanent solution. Patients deserve portability in their health insurance, and they deserve affordability. They deserve the peace of mind when their parent or their child or they themselves are in their hour of crisis, that they can count on getting the best health care America has to offer. Because sometimes politicians in Washington forget, health care isn't about systems or rules and structure or even markets. It's about real people and real families and real lives. So my commitment is simple. Our commitment should be simple. No one who has Obamacare subsidized coverage today will lose that coverage tomorrow. And we're equally committed to providing long-term, state-designed, patient-empowering solutions that deliver better long-term results, safe, secure, affordable health care, and an improved economy. We commit that every patient with a pre-existing condition will be able to find affordable coverage. No one will hit a cap on benefits. Anyone can renew their health plan. That's our commitment. Health care is about patients, not politics. It's about doctors and nurses, not politicians. For the millions who have been affected, from the canceled plans to the higher cost, we are committed to the real solutions to protect patients from health care and make health care genuinely personal and genuinely affordable. Hardworking taxpayers deserve certainty, stability, and peace of mind when it comes to health care. A temporary extension of subsidies alone would not be enough. It'd just be another Washington gimmick. It would not address the very real problems with the president's health care law. Let's commit to each other, Republicans and Democrats, that we will show a little modesty. We won't assume we know what's best for every American, and let the states come up with solutions. We'll work together to return power to the states, to the people, and really to the kitchen table where most health care decisions are made. I know what you're thinking. I'm new, been here for 6 months. Maybe I'm a little bit naive. But I've herded a lot of cats in the North Carolina legislature, and I've stepped up to very serious challenges, and we produced a lot of good results for my friends and colleagues and citizens in North Carolina. I know it can be done at the state level when policies are on the line that have a real impact on our neighbors. Neighbors we have to face in the checkout line and in the church pews. I'm looking forward to providing a solution to the health care problems in the United States. I'm looking forward to seeing bipartisan cooperation to deliver on the promises that we make here and fulfill the promise of fixing health care for our great country. Thank you, Mr. President.